A very good afternoon to everyone. We welcome you to another Prime webinar. My name is Fahad Shahid, and an important webinar session that we are going to do today with an important personality here. As we would, we know that cuffing is really an important thing that we really look forward speaking about COVID-19 a lot. It is one of the symptoms of COVID-19 actually if you're coughing a lot. So we are going to talk about the reasons why your cough may not be improving. Maybe you're not taking care of it, or maybe you're thinking of it that it is something else and it comes out to be, it happens to be something else. So when to seek the medical advice, we are definitely going to talk about this today. I have here with me Dr. Om Prakash, who's the internal specialist in internal medicine and currently practicing in Prime Medical Center at Ajman. Doctor, thank you very much for joining us today here.
Thank you for having me. Nice to hear, Prakash.
Great. So, as I said, that cough is an important, mechanism that we need to look into why we do that and why we have to look into that, why we need to take care of it. Dr. Om Prakash is going to put some light on all those aspects of coughing and the reasons of cough actually, and definitely he's going to tell us how this primarily works, and of course he will be putting some light on the cough that could be related to the COVID-19 if somebody is actually having such symptoms. So before we move on forward, I would like to request everyone to please put up your questions. If you have any questions, put your questions in the comments related to the topic today, that is why your cough is not improving, and doctor will be answering the question live here with us. So, Doctor, without wasting further time, thank you very much once again for joining us. Doctor, the question is actually there big on screen. Why your cough is not improving? We really need to understand when to take the medical advice and how do we improve it actually. So, Doctor, I would really like you to put some light on it. Thank you very much.
Good afternoon to all of you, those who have joined with me. So today, as we know the topic, everyone can, why the cough is still persisting. So basically, what is a cough? Cough is a protective reflux mechanism. When we inhale some irritants, by doing cough, we expel these irritants, which could be in the form of, say, microbes, foreign particles, smoke, or even some mucus. Sometimes we want to clear it from our respiratory tract or from the throat. The mechanism of the cough, that our tracheobronchial tree is have a cough receptors. When we inhale some irritants, they get stuck into this lining mucus in the tracheobronchial tree, and after that this cough reflux send information to the brain send back the information to the respiratory muscles and the abdominal muscles to increase the forceful respiration in and out, which leads to expulsion of mucus by coughing mechanism, by which we propel this irritants from our tracheobronchial tree. So the cough, normally we divide into the three categories are there for the cough. Those are the acute, subacute, and then chronic. Most of the times, cough presents with the acute. When we say acute, it is less than 3 weeks. Subacute, 3 to 8 weeks. And more than 8 weeks, it's a chronic cough. So the acute cough causes are normally common cold, acute sinusitis, acute pharyngitis. And when these symptoms improve after, say, a week time of treatment, then some of the classification, it goes subacute, where we say the post-viral syndrome. Then there is the subacute causes. There will be a subacute bronchitis, some types of asthma like subacute cough variant asthma. These falls in a subacute. Then the third category comes chronic cough. There we has a duration for more than 8 weeks. These are bronchial asthma, various subtypes of asthma, GERD, gastroesophageal reflux disease, even the tuberculosis, chronic bronchitis, uh, even the sometimes in the possibilities are lung cancer. So these are the causes for acute, subacute, and chronic causes of cough.
Thank you very much, doctor, uh, for this initial information that you have given. Doctor, talking about the mechanism of the cough, why do we cough, doctor? Actually, what is the basic reason behind coughing? Actually,
As I mentioned, that there is a cough receptors are there in the tracheobronchial tree. So when they get irritates with the allergens, so it's a protective mechanism by which we do cough.
okay, okay, understood. Absolutely, absolutely. Doctor, talking about the current situation, the current what we're facing, pandemic, we've seen that cough is a part of symptoms of actually COVID-19. Uh, you've got any information or anything light on this you can put?
Regarding this, from the for the cough in the COVID patients, this is occurs in three different ways. Number one is the cough is as I mentioned, is a protective mechanism to expel the irritants. So in the initial stage, it's a dry cough. Mainly, it's a dry cough. Patient have a fever. They try to expel these allergens, but some it remains there for say more than 2 weeks or 3 weeks. Then still the cough is persisting. When the patient improves completely from the COVID or partially, the cough is still lingering out there. So this is because of the clearing the debris from the injury which has COVID has causes to the lung tissue. So this is the main reasons to have a cough, dry cough mainly in the COVID patient.
All right, thank you very much, doctor. I have a question here from Miss Sunita, and she's asking: are cold and cough remedies harmful to people who have an early COVID-19 infection?
No, not at all. So uh, this home remedies you're talking, right?
Yeah, yeah.
So home remedies. So basically, the cough, a common cold, it's overlapping to each other. So the initial, it will be very difficult to differentiate between both of these. That is a COVID or it's a upper respiratory tract infection or say flu. So in the both the cases, the home remedies like drinking warm water, keeping away from the allergens, stop smoking, keep taking a symptomatic treatment like anti-allergic treatment. If having a body ache, paracetamol or various type of NSAIDs, these are the common treatment in most of the flu patient, those who get this kind of symptoms.
Understood, doctor. Doctor, there is a term called postnatal.
Yeah, post nasal drip.
Yeah, are you able to hear me? Yeah,
Yeah,
post nasal drip. Can
yeah.
you tell us about it, doctor?
So post nasal drip, actually, what happens from the environment in our body is in contact with the from the nose we expose. So if any allergens from the tracheobronchial tree, there is a minimal secretion throughout the day. It is happening to keep the moisturizing our tracheobronchial tree. But when we exposed to the allergens, these secretions are increased in quantity and their viscosity it changes. So when the secretion of mucus secretion increases, it comes out through the nose and back it tickles down in the throat. So when the tickling of the throats occur, then patient starts having coughing.
All right, thank you, doctor. Yeah, yeah. Please, you continue with your
Yeah.
answer.
So this is the reason to have a post-nasal drip. This happening, there is an increase in the secretion, which irritates, and patient starts coughing. Try to clear out these secretions from the throat.
Okay, understood. Doctor, Miss Rafia is asking, after COVID recovery, my husband developed expectorative cough. It's often he coughs and spits. He took honey for a long time, though after COVID, any reason?
As I mentioned earlier, the COVID patient, when they recover, they have a cough. Some it depends on the individual. They may have cough for long duration, say even a month or 2 months. The cough can last. It depends on the individual how they have responded to the COVID. Symptomatic treatment do improve, but it doesn't completely cure. Now, basically, it's these are the dry cough in the COVID patients. But sometimes when they have a secondary infections, patient may develop a very small amount of productive bulgum comes out or sputum comes out. In those patients, they need a different treatment approach in the form of they need the home remedies to continue. There is no doubt about that. We should continue the home remedies like drinking water, honey, warm water, doing gargle, keeping away from the dusty environment, allergens, or humidifier at home. Those treatments are there. There is no doubt about this. But these patients need some specific treatment. Normally these kind of patients, when they come to me, I start them on with Montelukast or and then I give him the bronchodilator, short acting bronchodilator, and steroids inhaler, and those patients do quite well on these treatments. So I think for her husband, he needs to be evaluated in detail that what could be the reason for persisting of cough, and then accordingly some treatment has to be modified. I hope I was able to answer the question.
Absolutely, doctor. Thank you. Thank you so very much for answering that question, doctor. Another question, doctor, I would like to ask you is that what are the differences between coronavirus induced fever, cold, or cough and a normal fever, cold, or cough?
See, these all are these all entities overlapping to each other. Most of the symptoms are present in all these three conditions. Someone having a more, say, high grade fever, someone are having very less fever. Again, this varies on the individual's immune response. But the basic difference will be that in the COVID patients, there will be a high grade fever, persistent dry cough, and there will be a loss of taste and smell, which are not common in other conditions, which like common cold and flu, associated with generalized body ache, fatigue, malaise, which is more common in the case of COVID patient. So after, I just tell you something that when the COVID patients they recover and then they come to us for follow up, normally when I ask them the retrospectively questions that what was the symptoms they have, more and all you can see that symptoms are similar to the flu, you can say, or common cold. But the main differences are here. They have various grade of severity of body ache. They are not able to get up from the bed, and dry cough which persisting, and then along with loss of taste, smell, and sense. Some patients have vomiting. Some of those they have a diarrhea also. These are not common with common cold and flu symptom patients.
Absolutely. Thank you. Thank you so very much, doctor. Moving on to the next question, doctor. Doctor, can gastric stomach diseases cause chronic lingering cough? And is it good to take medication to suppress my cough?
So there is a, you have asked me in two questions in this.
Yeah.
The gastric esophageal reflux, commonly known as a GERD, is consists 25% of lingering dry cough. Only you can diagnose it with very high suspicions. You should have, otherwise it's very difficult to diagnose. Why? Because most of the patients, or say 30% or 40% of patients, they do not have typical symptoms of GERD, that is burning sensation in a retroesternal area. So how we diagnose this? So diagnosis depends basically on the history. The history patient gives, he has a dry cough mainly in the night time after taking a heavy meal. When he lie down, the cough is increases. So why it is happening? Because the gastroesophageal reflux, gastroesophageal sphincter get relaxed. The gastric container enzymes keep irritating the lower part of the esophagus, and then it reflexes as a cough. The treatment is basically we should go for the symptomatic treatment. Symptomatic treatment means first we identify what could be the risk factor in these patients. For example, they should avoid very spicy food. If they are consuming high amount of coffees and caffeine product, they should reduce. Avoid large quantity of meal in a one setting. They can go for frequent intake of meal. Not sleeping 2 to 3 hours, taking any major meal. Head elevation can be done. So if these symptoms, they should try. If they are smoking, I forgot to tell you that if they are smoking, they should avoid smoking. So after doing this, they will have some improvement. So then it gives a clue that the GERD may be the main cause of cough in this patient. Then we can start on a PPI. Normally, these patients do very well on 4 to 8 weeks of trial of PPI. Some of the patient out of this may not improve even after giving the PPI, like proton pump inhibitor, like omeprazole, pantoprazole. There is a big list of the name. Then we should further evaluate what could be the other cause, so that these patients require upper GI endoscopy and 24 hours esophageal pH monitoring. And one more thing we have to keep in mind, that the dry cough in most of the time is a multifactorial. What I mean multifactorial means that one particular region is not behind the dry cough. Like in this patient, the other possibility could be he may be having a postnasal drip or postnasal drip. So, and he's having GERD. Some patient may have a subtype of bronchial asthma, which is known as a cup variant asthma. So all the three things has to be looked in together, that really the GERD is responsible for the cough, or then is the other multifactorial factors there.
Thank you
Yeah.
so very much, Doctor. Doctor, moving on towards the next question. Doctor, asthma and COVID 19, as you just mentioned asthma here, so I would want to move on to that. Asthma and COVID 19 have some common symptoms, including chest tightness, coughing, shortness of breath. How is asthma awareness important in this?
As you rightly said, the symptoms are acute. All the symptoms of acute respiratory symptoms, whatever disease, if you as I mentioned in the earlier, acute, subacute, or chronic, they each and overlap. Now in case of bronchial asthma patient, they are fully aware that what kind of symptoms they are used to have. Second thing, each and every patient of bronchial asthma, they know that when their cough worsens, then what are the symptoms happening? Like some of the patients of the bronchial asthma get their worsening of the cough, or say we say the terms of acute exacerbation of bronchial asthma. They know what happens. Some upper respiratory tract infection develops, then pneumonia develops, or they go exposure to some allergens which they are known to, knowingly or unknowingly they come to expose to this, the symptoms get worse. And on top of that, nowadays, we are surrounding with the pandemic. So even if little bit changes in the pattern of cough or say symptoms, we start thinking, do we have got COVID-19 infection? So in these patients, those patients are bronchial asthmatic patients. They don't have to worry at all on that part. They don't have to be very anxious that they may have got COVID or not. Very easily, they have to think down that symptoms what they had earlier in their acute exacerbation, are they are matching with this, or is something new had happened? Have they have come a contact with the COVID patient? Does any changes in the say not working the treatment which they used to take regularly, like bronchodilator or steroids? then loss of smell is there. So if these things they take into the consideration, they will able to differentiate between that really they are going to have a COVID infection they acquired or is a worsening of the asthma. And these patient also has to be keep in contact with their treating doctors to informing this that symptoms are the previous symptoms or the new symptoms has keep changing. So do I do something has to be do something more for this. And some of the signs are very alarming in the bronchial asthma patient, though even it may not be COVID. So this will be the acute exacerbation. So those are the signs that patients start having fever. Then there is a hypoxia. Patient becomes breathlessness. Their wheezing sounds increase compared to not responding to the steroids, the dose which they were taking earlier. There is a altered sensorium, not able to speak properly or become dyspneic while speaking. So these patients maybe have an acute exacerbation of asthma because of acute upper respiratory tract infections. It may not be COVID. So they have to be very aware on this part because sometimes it becomes very difficult to differentiate between both of them. I hope try to
Yeah,
clarify the doubt.
absolutely, doctor. Doctor, thank you so very much for clarifying that. Doctor, moving on towards the next question. Doctor, essential. We want to know, is there a difference between smokers and non-smokers cough? Are
Yeah.
smokers more at risk of COVID infections? Is it? This is the second part of the questions. If we have also heard that some blood pressure medication can also induce coughing. What is your advice
I'll
on this?
come. I'll come one. I'll come one by one. There
Okay.
is no doubt that the smokers are very high risk to get a COVID infection. Not the only the very high chance to get a COVID infections. If they acquire the infections of COVID, there is a very high chance to get the severity of infections. They may be very severe compared to non-smokers. Why do I say so? Because when you smoke for long duration, the lung parenchymal changes takes place much more earlier. So to fight the and then there is a decrease in the immunity also. So to fight the COVID, you need your immunities should be very strong, and in the smoker patient, this has come down. Second thing, what happened, which is a very common, that when we start having the smoker patient start having cough, he thinks that it is maybe I was having this cough for long, so nothing new in this. And then suddenly he comes to know that he got the COVID and the infection has spread to the acute has become now moderate or maybe severe. So the time which has to be timely when we able to diagnose this, we get delayed in this. So this is the regarding the smokers when they acquired the um, uh, COVID infections. Second question, what you were asking, Stefan?
Yeah. The second question, what I was asking is that, are smokers more at risk of COVID infection?
Yeah, as I mentioned. So these
Yeah.
questions I have
Okay.
asked. The other
Okay.
questions were there.
We have also heard that, doctor, some blood pressure medication can also induce coughing.
Yeah. So
What is your advice?
blood pressure medicines. I have divided into the two groups. And if you see in the literatures, only the AC inhibitors patients are those patients are taking AC inhibitors like lisinopril, ramipril, perindopril. These patients do they start having only dry cough. Now, when they start having dry cough, there is a not clear-cut idea that when they will have these symptoms. Some patient may develop, say, within a month. Some may not develop, say, even 1 year or 2 year. So when we evaluate the patient for dry cough and then we ask them, do they are taking any hypertensive medicines? And then when we suggest that this could be the reason, the response comes immediately that, doctor, I was taking this medicine for long, 1 year, 2 year. Why cough is now? So it is not necessary that after taking the treatment of AC inhibitors, the cough starts immediately. It takes time. So in these patients, when the chronic cough, they goes in the by classification, they fall in the chronic cough. One simple X-ray to be done. If we think the chest X-ray is clear, then we go to switch over this antihypertensive medications, AC inhibitors. Other modalities are available. We can switch over to the angiotensin receptor blocker. Those are the lisinopril, telmisartan, sorry, telmisartan, valsartan, irbesartan. These are the angiotensin receptor blockers are there. We can switch over to them. Within 4 to 6 weeks, their cough subside. They don't need any treatment.
Perfect. Thank you very much, doctor. Doctor, talking about another smoke-related question. If someone is smoking a cigarette and coughing simultaneously, could they transmit the cough virus, the COVID virus, if they are positive?
Yeah, of course, why not? Cough, the mode of transmission for the COVID is the droplets, acute upper respiratory tract infection, and second is the contact. They are smoker or non-smokers. If they are coughing, they are definitely going to transmit the infection to others. Now, why this question has come that smokers, why we are saying particularly in case of smokers that smokers are tend to transmit the COVID infection or not? Because initially, some of the publication or somewhere article came in the in the market that those patients are smoking, they are very less chance to get the COVID infection, but those are not true at all as far as the recent research have done. So there is no changes, if you can say, in transmitting the infection compared to the smoker and non-smoker patients. Yeah, Mr. Prakash.
Absolutely. Thank you. Thank you. Thank you, doctor. Uh, Doctor, I have a question here from Ms. Sheetal, this is the question that appears on the screen. I have bronchitis. How should I take care of it?
See, bronchitis again defined into the two types of bronchitis comes. The duration wise we have to go, it's acute bronchitis or chronic bronchitis. Acute bronchitis subsides say within 3 to 4 weeks of time. Some patients goes on for the after some time they become asymptomatic. Later on they transfer into the chronic bronchitis. So acute bronchitis, again the symptoms may be the patients have exposure to allergens, they have a dry cough, productive cough, depends on the if underlying infection is there. So the course of antibiotic, the acute infection subsided, and the symptomatic treatment like antihistamines, those are paracetamols. um, so with this they improve, but they may later on have recurrent episodes of these infections after the persistent exposure to allergens like dust, pollen, pet dandlers. So those patients has to be very careful. The acute component, the acute bronchitis can transform into the chronic bronchitis.
Thank you. Thank you very much. Doctor, is it true, as I asked earlier, regards to, for example, a home remedy? When you talk about home remedy, doctor, a lot of people say that we can take quickly as a little spoon of sugar or honey to just stop the cough. Is it is it okay? Is it a myth or is it true?
Very difficult to answer these questions because nowadays all type of home remedies, we all try to suppress the cough, but only symptomatic treatment improves just for say you can say for time being. This will not cure the cough. The episodes of the cough may be subsided, but the dry cough will keep continuing. We have to find out what is the reason behind this cough. Unless until the reason is not addressed, treatments are not gonna offer any benefit to the patient. They should continue this. They honey or warm water, this one inhalation, those things are there, they have some benefit, but this will cure completely, I don't think so. We need to find out what is the reason behind this cough, and that has to be addressed, which I mentioned earlier. There is so many causes. These are not going to improve with the symptomatic treatments.
Absolutely, doctor. Thank you. Thank you. As we are moving towards the end of the session, doctor, I would like to ask you a question here before this is the last question that I would ask you. Doctor, the transmission of COVID-19 is not yet accurately known, but is the patient contagious without coughing?
Yes, patient is contagious. See, the mode of transmission of COVID so far we have come to know is the two transmission is there. Number one is the airborne transmission, and second is the contact transmission. Lot of patients we have you may have come across, and we all have come across that some of the patients are asymptomatic. They have acquired the infection, but symptoms still yet not have developed. Some patients have acquired the infection, symptoms develops later on, but because of the virus load compared to the other upper respiratory infection in these patients are very high. So even they are not having symptoms, say like coughing, but still they are able to transmit the infection by contact transmission, close contact when they come, or while simple while talking, and all these patients they don't aware that they have any symptoms, and they go for their daily activity, they go for their work keeping in mind that they don't have a symptoms, but still they can able to transmit the infection to others.
Great, great. Thank you. Doctor, thank you so very much for all the questions that you've answered. It was really a very informative and useful session that you've given us so much of information and knowledge on this, and we have really understood a lot of things. Doctor, any take-home message that you would like to give us?
Take home message will be that any high grade of fever with cough with malaise, please do not consider this it's a common cold or flu. It could be COVID unless until proof otherwise. So just sitting at home, I have not come in contact with anyone. I have taken a vaccine. Even if you say some people say I've taken a vaccine, how I'll get the COVID? It's not true. The contact history is there, exposure history is there, and symptoms are there. They have to think that it could be possibility of COVID infections. Now, when this comes these symptoms, what they should do? Number one, they should inform to their workplace where they are working. They have acute upper respiratory tract infection symptoms. They should not go to the work. They avoid to going to the crowding place. They try to self-isolate themselves. Keep watching their symptoms. That does their symptoms are improving or deteriorating, or any new symptoms is developed. Like some patients having loss of taste or smell sensation after 1 and 2 days. Some patient develop dry cough after 3 or 4 days. So they have to keep watching their symptoms. Those patients are having a chronic conditions like diabetes, hypertension, heart problem, bronchial asthma. These patients should keep in touch with their own treating doctors, that possibility of I am having acute respiratory tract infection. If anything goes wrong, what I should do, and if not able to symptoms are not improving, they can take home remedies as we have discussed, the paracetamol and over the counter medications. If still is not improving, they should go for the COVID test. There is no need to worry for at all. When they do the COVID, if diagnosed much more earlier, still some treatments are there that we can start, and we can delay the progress or severity of infections.
That's really great message, Doctor. Thank you so very much for all the information that you've given. We've received a lot of appreciation that was recently shown on the screen. Doctor Om Prakash is currently practicing in Prime Medical Center, Ajman. If you're looking forward to see him in the clinic, the number is at the bottom of the screen. That is 04707099. You can always book an appointment with him. If you're using Prime Health app, then download the app. Then you can book an appointment according to the schedule of the doctor. If you have any feedback that you want to give us, please do send us an email or at myprime@primehealth.ae, or any question that you might have to ask, and we will be coming back to you on this. Uh, your reviews are really important to us, and we would really request you to join us on Facebook page and our channel on YouTube, and give us recommendations and tell us what more webinars you would really like to see there, so that Prime Healthcare can definitely put on and bring forward the awareness on it. As we always say, that Prime is all about personalized care personally, and that's what we have to say today. That you really need to look into the cough. If you are coughing then please seek medical advice whenever it is important, it is necessary. Do not engage yourself into all the time home remedies, because you might not know what is the reason for this cough. So thank you very much everyone for watching us. I will be coming back to you with another live session. Till then, Prime is all about personalized care personally. Thank you very much. Take care. Bye bye.
Thank you. Stay safe, stay healthy.